And welcome back. Right now, 9:16. And when your thyroid isn't working right, it can cause all sorts of disruptions to our health. And of course, up next, we're going to be getting some expert advice right now from, of course, Dr. Schwertner. Dr. Schwertner, thank you very much for joining us. And, thyroid disease affects 27 million Americans around the, around the country. And how do you even know, first of all, if you have an issue? And let's talk about first, what does the thyroid do? And then we can talk about some of the symptoms and things that we have to look out for.
So the thyroid is a gland in your body. It sits basically at the base of the neck, and it produces thyroid hormone. The thyroid hormone controls a lot of things in our body, such as temperature regulation, metabolism, and other functions. So it's pretty important. It's one of the big glands of the body.
So when it comes down to getting your thyroid examined, and a lot of people may just not even think about it, when I go get my blood work done annually, is that the time to talk to your primary about, maybe some symptoms we would look out for? Or is that something that you would just get checked as you're getting your blood pressure checked and your heart rate and all that stuff?
Most primary care physicians should do a thyroid checks for your annual labs, at least a screening. But sometimes, they'll have to do further testing if, in fact, you are having some of the symptoms of hypo or hyperthyroidism.
So, perfect segue. Hyperthyroidism. What is that? What are the two differences between those?
So hyperthyroidism is when the thyroid gland produces too much thyroid hormone. And some of the symptoms you might see are anxiety, irritability, diarrhea, rapid weight loss, insomnia. And that is really important that if you're having any of those symptoms, you should ask your doctor about the hyperthyroidism. Another type is hypothyroidism. In hypothyroidism, it's when your body doesn't produce enough thyroid hormone. So you have things like rapid weight gain, fatigue, muscle weakness, and constipation even.
So let's talk about who's really at risk. I mean, are there any factors of male or female or age? Who's at risk?
So females in the perimenopausal age are at risk. All persons greater than 50 years of age. If you've been exposed to chemicals or radiation, and even a family history of autoimmune disorders, those are higher risk factors for developing thyroid disease.
So if you're exposed to, like you said, tobacco, radiation, certain chemicals, smokers, higher risk?
Yes, they are. Tobacco is a higher risk of having thyroid disease.
So what about over or under consumption of iodine found in seafood? We all eat a lot of seafood here. So salt, vegetables, things like that. Diet is a big part of this as well.
So iodine can cause hypothyroidism, and you do see it in other countries that don't have iodine in their diet. You'll see these persons with big goiters, and that is a sign of thyroid disease.
So many times when you go to the doctor, you get a history, a history of cancer, a history of different things in your family. What about health and history of thyroid disease from really generations?
Yes, so it's important to tell your doctor if there's any family history of thyroid disease, because you may be more likely to develop it as you age.
So sometimes it's misdiagnosed. Why is that?
So sometimes you might have the symptoms like I talked about with hypo or hyperthyroidism, and they may be treated. So you go to your doctor, you say, I'm really tired, and they tell you to exercise, eat healthy. So it may go on for a number of years before it's diagnosed, unless you bring it to attention that, is this my thyroid? So it's something to really ask your primary care provider to check.
All right. Well, we appreciate your time. And, of course, we all think of our thyroid as just, hey, it's there doing its thing. But when it goes awry, you can certainly have some issues. Dr. Schwertner, thank you very much for joining us.
Thank you for having me on the show.